Let's talk about our Hospitalist and Nocturnist program. Well, first off, let's talk. What is a hospitalist? That's a term we use in healthcare that not everybody utilizes.
So the hospitalist program it's a physician or a provider, nurse practitioner, physician assistant that takes care of you when you're in the hospital bed. So traditionally, our family practice doctors would come in and out of hospitals and take care of their patients, and we still have some that like to do that from time to time. However, with the volume of patients and the need in the community for just outpatient visits, it's really taxing on a family physician to have to do that. Also, it's challenging for the nursing teams within the hospitals to be able to contact that physician if that patient has a need. Let's say they need a medication change, or they've had a new symptom or something else come up. Well, they're calling the clinics trying to get in touch with the physician who's in the room with the patient. It becomes a challenge. And so the hospitalist programs came up, probably 15, 20 years ago approximately, and have made their way through most organizations, hitting the smaller organizations last, of course. We started that program about a year ago, and we are happy to have two wonderful nurse practitioners here that take care of each of the patients during the day. They communicate with your primary care physician when needed. They communicate with the specialist when needed. If they believe that a specialist is needed in your care, they will write a consultation and have that specialist come in. It's an internal or critical care specialist, our general surgeon, orthopedic surgeon. They help make those decisions. What it does also is that there's someone on the inpatient unit 10 hours a day available to take care of any of those needs. And that frees up the time from the family practice docs so that they continue to care for all of those people in the outpatient standpoint. Now everybody's going to go, okay, what happens after those 10 hours? That's where we have a nocturnist. So that is another big fancy word for nighttime doctor. Those nighttime doctors or nocturnists, they come on right after the hospitalist during the day leaves. Nocturnist is a internet-based live program where basically you have a telemedicine physician who is available for the nurses 24/7, and they can see the patient. They can have the nurses check the patient's vitals. They can look at the patient's charts, and they can help make decisions at night to help take care of you and make things smoother. Now, don't worry, that doesn't mean that there's not someone available in case something happens. Our hospitalist and nocturnist program are connected with our ER program. So our ER physicians are available 24/7 in the hospital anytime there's an inpatient who has a need. It comes up that the nocturnist or the nurse practitioner program or hospitalist program can't take care of. So there is always a physician able to lay hands on you and check you out live and in person in the event that that's necessary. So it's just one more tool to allow a little bit more consistency in care and a little bit more speed of care and efficiency. A lot of times those calls those nurses have to make are for just minor medication changes. Let's say you got all of a sudden you're having some nausea or something. They can't give you any medicine for that until they talk to the doctor. So if that's at midnight or 2 in the morning, now we're waking up the family practice docs for an order like that. The nocturnist is there available from the time that the hospitalist leaves until the next morning when they arrive again. So we're very excited about that program, and we've already seen a significant change in just everyone's feeling of comfort with having someone available all the time.